Jump over to patient transfers. Okay, so feel free to touch those when you're done. And we're going to talk about patient transfers now. I'm going to use Guy as my handy guy. I'm going to transfer. As you can see, Guy's a little bit bigger than I am. So Guy, have a seat. And sorry, I'll go like that. Okay. So I am 6'2", 200 pounds. I think I'm pretty big, and actually I'm bigger than most of you guys in the room here. There are patients that you guys have that might be the same size as Guy that you guys need to lift. You need to get Guy from his chair or from his hospital bed to the commode, to their wheelchair, and I might be able to grab Guy and a big bear hug and move him. But if you were to do that with 30 patients every single day, you're going to be calling Raul and say, hey, boss, my back hurts. I have an LMI claim, and that's the last thing he wants. I manage 17 employees, and I hate LMI claims. So always take care of your body, never hurt it. So I'm going to talk about how to do a safe Hoyer lift transfer. And I didn't realize there was going to be as many people here, but I have those yellow worksheets talk about how to do a safe transfer. If you want more of these, shoot me an email, and I can actually email you a copy of it. So what we have here is a Hoyer lift sling, and this is a nice big one actually. So what you have here is you have handles on the back of the sling. I'm supposed to tell you you're only supposed to do Hoyer lift transfers with at least 2 people. You should never do a one-person transfer. If you want to, that's between you and your boss. But I'm supposed to tell you you're supposed to always have 2 people. Now, on the back of the slings are handles. So when you put your sling on the back of the patient, what you don't want to do is you don't want those handles to be on the inside, because one, Betty Smith is going to complain that it's jabbing her in the back, and 2, now you don't have anything to grab onto. So Guy's going to be dead weight for me. Let's say he's sitting in a chair, and what you're going to do is you're going to basically put the Hoyer lift sling on the back of your patient. So what you'll do is you'll say, hey, Mrs. Smith, Guy, please lean forward. And if they don't lean forward, you just push them. And this is where it's really nice having 2 people, because you can have one person pushing the patient and the other person, shoving the sling where it's supposed to go. Now, as we just saw about pressure ulcers, you don't want to shove them real hard, because now all of a sudden we have friction, and you can actually hurt a patient if you were to just shove it in there. Now, I don't want to ask you to raise your hand if you've ever done this.
He was dead weight. Because I see a lot of assistants there.
Yeah. One of the things...
For the sake of time. Yeah, for the sake of time.
For the sake of time, because you said you wanted me to be less than 30 minutes. One of the things I've seen all the time, people will say, I just can't figure this patient lift thing out. You want the top of your sling right here at the bottom of the armpit. What's going to happen is usually you guys are worried about them slipping out, so you leave it up here. If you do that with the patient, what's going to happen is when you lift the patient up on the Hoyer lift, you're going to swing them into the fetal position. And now you have some little old lady saying, help! Because they've swung up like this. I'm not going to ask you to volunteer if you've ever done that to a patient before. But if that ever happens, it's a #1 sign that your sling is up too high. You want the top of the sling right here. So that's one of the things we're going to do right now. Is I'm just going to make sure the top of the sling's right there. I'll shift Guy to the right side. Shift him to the left. So you can see right here what we have is the top of the sling is right here at his arm pad. And thankfully, most of you guys have patients that will at least help you out. Mrs. Smith, can you slide up on your right side? Can you do on your left? So then you can kind of pull it forward. So now, once you have the patient positioned, you always need to know where you're going to take your patient. Don't get them up in the sling and say, now, where are we going to go today? then they're sitting there hanging, and you're like, what am I doing? And then they're screaming, and so always know, okay, we're going to go from this chair to his wheelchair right here. Make sure that there's nothing in between the two of them. Or make sure that there's no, well, if it was in my house, make sure there's no Barbies on the ground. Just make sure there's nothing in the way. So basically, you're doing a very fast transfer because the last thing that patient wants is just to be hanging there for 3 minutes because you forgot to move that patient's diapers that were sitting on the floor. So first, you're going to position this. You open the legs right here. You actually have to put it forward and go like this. I've had some other adult family homes. They will try and force it. If you force something, it will break. Then you have to call us and say, hey, our patient was broken. So that will open up the feet. Second is you want to use this to have the lift go up. Now what you'll see right now is it's not going up very fast, which means I haven't closed it. There is a little tab right here that you will flip, I guess that would be clockwise, and that closes it. So once it's closed, now it will raise up. So another thing is I'll have people say, hey, my lift isn't working. Well, it's because this little thing here is closed. So you want to make sure that this raises all the way. The last thing you want is the patient hitting their head on it. Okay. And I don't want to do a single person transfer, so I need a volunteer. Who's going to help me? Okay. What's your name, sir? Mike. Mike. I'd love some help, Mike. So Mike's going to help me. Don't step on the cord. Okay, so Mike. So what Mike and I are going to do, we're going to communicate. Mike, we're going to go from right here to this chair right here. And so what I'm going to do is I'll drive the patient lift, and all I want you to do is just make sure that the patient stays stable and hanging in the right direction. Because what happens, you can actually pivot this right here. So if I'm driving the Hoyer lift, and guy starts moving around, next thing he knows, he's on a trapeze just flying around every which direction. Which might be really, really funny, but it's dangerous. So, and this is also why the handles on the back of that patient lift are very, very handy, because Mike, with very little effort, can position Guy so he's not going to hit his head on there. And also, when we get close to this chair, he'll be able to position him right over the chair and kind of pull it up so the back of his butt goes into the back of the chair instead of Guy sliding out of the chair, which might have happened if you did an inappropriate transfer. So what I have right now, I'm ready to do the transfer. And what I'll do is I'll slowly lower this down. And I'll say, Mr. Roberts, it would be very helpful if you can fold your hands like this. Some of your patients can do this, some of them can't. But if their hands are here, they're not going to get themselves in trouble. The last thing you want is their hands just flying out, getting caught in this. Or, if you might be able to think about it, there's this little doohickey thing right here. If you have someone that's a little spastic and they're flying their arms around and they hit that, what's going to happen? They're going to drop themselves. I've talked with a couple pediatric patients of ours where we've warned them, they're like, oh, we don't have to worry about that. Next thing they know, their son hits it and they go, boom! It depends on how heavy they are too. Guy would probably drop a whole lot faster than most of you here. So first, what we're going to do is, you'll notice on a lot of these, because I've never lifted Guy before, there's different colors. And what you'll do is you'll kind of memorize what patients are what colors. So I'm not sure, but let's say if I've done Guy a whole lot, I'll know, okay, it works best if I use purple on the top and green on the bottom. So we'll use a couple blacks is what we'll do.